Hi, my name is Nadia, and welcome to Family Planning and Abortion for Medical Students. I am currently a third-year medical student in the Northeast. I created this video series because I am passionate about reproductive health and justice, and I believe that all medical students should be informed about family planning and abortion as it pertains to medicine, regardless of their intended specialty. Through my school's chapter of Medical Students for Choice, it has come to my attention that many programs do not teach these topics as part of their mandatory curriculum. My intention with this video series is to help preclinical medical students build a foundation of knowledge in the topics of family planning and abortion before third-year OBGYN clerkships, regardless of whether or not their medical school teaches these topics. Although I am intending this information for medical students, anyone should feel welcome to watch. I will be covering the following topics throughout the series: an introduction to family planning and contraception, covering the below methods of contraception in a 5-part series, barriers to contraceptive use, the epidemiology of unintended pregnancy and counseling resources, methods of abortion, and the public health impact of the legal status of abortion, which I have updated a bit and will speak on some of my experiences I've had on my own OBGYN clerkship since first creating these videos. This list was made using standards created by the Association of Professors in Gynecology and Obstetrics, APGO for short. We will be covering topics 33 and 34 of APGO's educational objectives, which are family planning and abortion respectively. The learning objectives and specific APGO objectives will be stated at the beginning of each video. These are the objectives for family planning. We will discuss the mechanism of action, effectiveness, benefits, and risks for each major type of contraception, as well as emergency contraception, barriers to accessing this contraception, and the methods of permanent contraception. And these are the objectives for abortion. We will discuss the methods of abortion, as well as complications and the public health impact of the legal status of abortion. I will provide resources for non-directive counseling methods. And generally, because I cannot fully cover all of these objectives in this format, I will be linking other resources to supplement the presented material. I have Medical Students for Choice to thank for bringing my awareness to the importance of these topics. If you are a medical student, I encourage you to see if your school has a chapter or to consider starting one. They have really great resources and events that you can host to educate yourselves and your classmates further about these topics. A few notes before finishing up this introduction video. If you're not familiar with these topics, there are a few terms that have the same meaning that could be helpful to know when discussing family planning and abortion, as people use a variety of terminology. I will mostly be using the word contraception, but references to birth control and pregnancy prevention also refer to this. I will mostly be using the word abortion or induced abortion, but you may also hear this referred to as elective pregnancy termination or just pregnancy termination. The word abortion has become quite politicized, so my advice is to keep that in mind when discussing these topics with people in your everyday life. POC in this series will stand for products of conception. This is a neutral medical term referring to the fetal tissue and placental tissue that is removed during an abortion procedure. I will use this term in the video regarding methods of abortion. Also, please note that I will be doing my best to use gender-neutral language in this series, as family planning and abortion are relevant to people of all gender identities and sexual orientations. However, some of the figures, studies, and statistics featured in these videos will use gendered language due to the way they were constructed and how data was collected. Hopefully, the field of obstetrics and gynecology and other areas of medicine can begin to move away from this language as we conduct more inclusive research. Thank you so much for listening. I hope you enjoy this series. Please look to find more information linked below if you are on YouTube, or in the individual course folders if you are utilizing the Thinkific course website.